afternoon, good morning, good day from wherever you are. It is a beautiful, bright, sunny, and shining afternoon in West Africa, Nigeria, where I am right now. And it is with utmost pleasure that I welcome every one of us present here now to this fantastic webinar on implementation science in healthcare, the way forward in Africa. And we are so glad that we have an expert, Professor Nadia Sam-Agudu, who has agreed to graciously enlighten us at this hour. And we do hope that every one of us will enjoy this. Here on behalf of AFREhealth to welcome all participants who are here present. And I'm personally so delighted to let you know that AFREhealth is fully represented here. We have our very own Executive Director of AFREhealth, Madam Georgina Yeboah. We have one of the Governing Council members, Professor Abdon Mokali. We have our past president of AFREhealth, Professor Abigail Kazambi, right here with us. We have Ellis Peterson. We are so delighted to have you. We have another member of Governing Council members here, Professor Georgina Odaibo. And we have the very team member that put all of this together for us, Dr. John Bosco, who is here with us. We have the very vice chair of West African chapter, Dr. Modibo Sangare. I also have with me very many eminent personalities that time will not permit me to mention their names. But please, you are most honestly and sincerely welcome. I welcome Behan Ewono Semangu, Witness Yahuma Teferejiman, Professor Simeon Ulubi, Sahidat Ibrahim, Prosper Lutala, Mukond Magido. We welcome Faud Faka, and I welcome Edison Igo Ogogo, Charity Welfare Accountant, Biahe Ewono Semangi, Bagdaki Rasha, Anas Babangida, Alusine Mustafa, Alalin Amusa Ado, Aderonti Adigun, Adiola Oluboyo, and every one of us, we are welcome. I just want to say on behalf of AFREhealth that we are so happy that this is happening at this time, that every research you want to do, I should not just stop at one end or should not just end on the bench. You will want it as much as possible to have a touch of implementation. And like I've said earlier on, we are going to have ourselves really and thoroughly enlightened as we participate in this webinar. Let me quickly, without too much ado, hand you over to Dr. Mobolanla Balogun, who is going to give to us the citation of the presenter of this wonderful presentation, Professor Nadia Sam-Agudu. Welcome, welcome, welcome from Nigeria. Thank you. Over to you, Dr. Balogun. Mobolanla.
Thank you so much, Prof. Priska. Indeed, we are excited. This is our maiden webinar for Africa, West Africa region. And we're delighted to have no other than Professor Nadia Sam-Agudu. It is indeed an honor. Before I read her citation, I can say, sometimes you hear about someone or you're just reading words, but I've had the opportunity to work with her in the past 3 years, and she's one of the people who inspired me to go further in implementation science. Her thoroughness is out of this world. Her passion is is exemplary. So I am deeply honored that we could get her to come and present to us just a little bit, I'm sure, of the wealth of what she does in Africa and beyond. So I'll read her citation. Dr. Nadia Sam-Agudu, she's a professor. She's a clinician, scientist, and professor of pediatrics in pediatric infectious diseases and the director of the Global Pediatrics Program at the University of Minnesota Medical School in the United States of America. Professor Sam-Agudu is also a senior research faculty and senior technical advisor for pediatric and adolescent HIV at the Institute of Human Virology, Nigeria. She has over 14 years experience in implementing HIV programs and conducting implementation research in Nigeria. She has also provided teaching and mentoring in implementation science in Nigeria, Ghana, across West and Central Africa, and in other countries. And I'm privileged to be one of those that have sat under her tutelage and mentorship. Professor Sam-Agudu's research focuses on implementation science methods for the prevention and treatment of HIV, tuberculosis, Mpox, and other infectious diseases affecting children in African countries. And just the other day, she was part of the panelists that presented still on an AFREhealth forum on Mpox. We are so grateful to you, Prof, for your relentlessness. Thank you. Most of her research is in Nigeria, Ghana, and other West and Central African countries for which she has been funded by sponsors, including the World Health Organization, NIH, European Commission, and the American Academy of Pediatrics. She's a member of the Nigeria Implementation Science Alliance, NISA, the Adolescent HIV Prevention and Treatment Implementation Science Alliance, AHISA, and she leads the Central and West Africa Implementation Science Alliance, CAWISA. Please join me, use your features, every, reaction to welcome with a big round of applause, Professor Nadia Sam-Agudu. You're welcome.
Thank you so much, Dr. Mobolanla, and it's been a pleasure working with you all these years, and I really have a good time working with you, and I'm also watching your star rise and very, very proud of how you've been doing, honestly. So today I'm going to talk about, one of my favorite subjects, which is implementation science, and combining with another favorite subject, which is talking about health in African countries. So I will move on and just give a little bit of an outline of how I'm going to handle this talk, making sure that I leave enough time for us to have some question and answer session. So first of all, talk a bit about implementation science and why we need it in Africa. I think for something that's regarded as a new or newish type of topic, that I have to explain what it is and have people understand it and understand how it can be applied in healthcare in Africa. We'll talk about evidence-based interventions, implementation strategies, and implementation outcomes. We will talk about theories, models, and frameworks. These are all the staple of the language and the methods in implementation science. And then we'll switch to talking about implementation science in healthcare in Africa and some examples of research and practice. And then move on to talking about IS in healthcare in Africa, but how we can all advance the field. And then end it with like a top 10 tips or 10 lessons for applying implementation science to your health research and or your practice in Africa, whatever country you might be in. So we'll start off with, what is implementation science and why do we need it? And so I want to, instead of jumping into definitions, just have you think about this for a little bit. Imagine all the research that's performed and published, and just going into one database like PubMed. As of today, PubMed has about 37 million records, 37 million papers that have been published. And much of the evidence we have is actually not used, or if it's used, it's not optimally used, it's not fully used. So this is a waste of time, waste of expertise and resources to conduct research and not use the findings. I personally actually think it's unethical to conduct human subjects research or health services research involving humans and not use the findings, because a lot is invested in it, and we are supposed to be doing research to improve human health and improve the human condition. And so more importantly, besides wasting time, expertise, and resources, the people who can benefit from these findings do not benefit at all if they are not put into use. or did not benefit enough. And this now becomes an issue of inequity for the people who need these interventions the most. So implementation science aims to fix this problem. And you hear terms like it helps to take science to service, it helps to take evidence into practice, it helps to take evidence into action. This is what implementation science is about. So if we want to go into talking about it in terms of the actual definitions, the code words that you tend to see in implementation science definitions, I want you to take note of that. The study of methods. Implementation science is actually a study of methods to promote systematic adoption and integration of evidence-based practices, interventions, and policies into routine healthcare and public health settings, and hence to improve the quality and effectiveness of health service. So you will see study of methods, adoption and integration into routine healthcare. We talk about public health. We talk about quality improvements and improving effectiveness of health services. That is implementation science in sort of the long form definition. Another definition says, again, is the study of methods to promote adoption and integration into routine healthcare and public health settings to improve our impact on population health. So public health or population health is part of the definition. Another one here is scientific study of methods again, and strategies. So this particular definition actually brings strategies in, and I'll show you down the line why it's important to mention strategies when we talk about implementation science, and facilitate the uptake of evidence-based practice and research into regular use, whether it's routine use or regular use by practitioners and policymakers. This one is actually one of my favorite definitions because it mentions health practitioners, our implementation practitioners, and policymakers, not only talking about researchers all the time, but really practitioners and policymakers. And you may all have heard about the no-do gap, that there's evidence sitting here in this sort of purple cloud. There's what we know, and then what we do, and there's a gap between the two. There's a lot of evidence, but not all of the evidence is being done, is being used. And so we have a gap there, and that's what implementation science attempts to close, that gap. Now, there's a last one, which is very simple, which is the study of methods to promote integration of research findings and evidence into healthcare policy and practice. So instead of practitioners and policymakers like the previous definition says, this mentions policy and practice. And this is also a very simple way of describing implementation science. Now, I want you to remember strategies. I think I've taught implementation science different ways for a while, but what I want you all to come away with from this is that it is a study of methods. What methods? Studies of the how. Implementation science is not actually about the evidence-based interventions. It's how to implement the evidence-based interventions. So I want your focus to be on that. And how to implement the evidence-based interventions is guided by or informed by the implementation strategies we decide to select and to use. So the closing of the no-do gap in implementation science is founded on the use of implementation strategies and the study of these methods to have the impact of interventions be better, be improved. All right. So why do we need this in Africa? And a lot of you have seen these maps over and over again. If you take the average disease map of the world, Africa just lights up like fireworks. And, sometimes as an infectious disease doctor, I look at it and I'm just exhausted because Africa just keeps lighting up. We have high burden for many diseases and death. For many of these diseases, resources are limited, but actually evidence is not, because there are other countries in the world which currently or in the past had high risk of having these diseases, but they have been able to use the evidence, apply the evidence, and have reduced disease incidence, they've reduced disease impact, they've improved health outcomes. Why can't we? So a lot of the diseases that we have to manage, and here I'm talking large infectious diseases, but you can also think about non-communicable diseases, chronic diseases, are really implementation of evidence issues, particularly when it comes to Africa. And so we can address these with implementation science. And yes, even the cost issues. even in a resource-limited setting, the cost issues can also be addressed with implementation science. So malaria, HIV, TB, child mortality, Africa just keeps lighting up. And so this is a place that could really use the methods of implementation science to make sure that we are efficiently and in a cost-effective manner applying the available evidence to make impact at population level. All right, so why is IS particularly important in resource-limited settings? And I alluded to some of that in the previous slide, but what I want you to note is that resource limitation does not only refer to availability. It could be there or not be there, but sometimes resource limitation is access and distribution and inequity in the distribution. So think about, for example, rotavirus vaccine in the US versus in Nigeria. Now, when you have an intervention, you have to first, or if you have an intervention that is potentially it potentially works, but you have to test it. So you have to generate evidence from the research. You have to synthesize the evidence. And then you have to develop policies to accompany the evidence-based intervention that you have discovered. And you have to actually apply the policies. And then in applying the policies, there are considerations for patient circumstances, patient's wishes, and the evidence itself, the nature of the evidence and how to implement it. So there's a whole process for how health interventions are developed. So think about this on the right, a publication that was talking about rotavirus in the US and the introduction of the rotavirus vaccine in the US in 2006. And I remember this very well because my second child was born in 2006, but he was born a little too early. He was out of the eligibility sort of age for receiving rotavirus vaccine. And he actually got rotavirus and got extremely ill. But thankfully he was fine. He's 18 years old now. So I remember vividly when this virus came, when this vaccine came up. Now look at the bottom announcement. Dealing with diarrhea, Nigeria introduces rotavirus vaccine into its immunization plan. Look at the date in red here, 2022. So look at USA 2006, Nigeria 2022. Okay, you are looking at 16 years before an available intervention was available in Nigeria. And so here is an example of the no-do gap. This gap is a 16-year gap. It is a rotavirus implementation gap, and many, many factors contributing to that gap in terms of the time it took and getting it implemented. So that gives you an idea of where implementation science could have accelerated the implementation of rotavirus and the widespread uptake of rotavirus vaccine in Nigeria. So implementation science, as I said, helps us to narrow that 16-year gap, minimize the number of Nigerian babies who died or who were sick from rotavirus diarrhea in the absence of vaccine in that 16-year period. And even though we do have the vaccine now, there's still implementation science applications because we need to scale up the use of rotavirus vaccine in Nigeria. All right, so what do we mean by evidence-based interventions? And the term we use in implementation sciences is sometimes call it the what or the thing. So evidence-based intervention is the thing that you are implementing. So IS aims to improve the use and impact of these EBIs, and they can be many things. In my previous slide, I talked about rotavirus. So it's an evidence-based, I talked about rotavirus vaccine. It's an evidence-based intervention. So those can be procedures, like how to administer something, or a procedure that has a, a standard operating procedure can be an EBI, a program, a treatment program can be an EBI, a product, like a rotavirus vaccine can be an EBI, a policy can be an EBI, pills, right, medication, an EBI, practices or certain principles. So EBIs, as I said, are known as the what or the thing in implementation science. So what are you implementing? As I said, rotavirus vaccine, HIV testing, TB treatment, these are all EBIs. All right, so implementation strategies. I said in the beginning that this is something that you have to take away from this talk, that implementation strategies are actually the key item or key items to consider in implementation science, not the EBIs, but the strategies. And implementation science, these are the how. So previous slide, we talked about the what, the thing. What are you implementing? Implementation strategies are the how. How are you implementing them? And these are actions taken to enhance adoption, implementation, and sustainability of these EBIs. So apart from saying it is the how, is the approach, is the style you take or the style you adopt to improve the use and impact of an EBI. So this is a schematic I use in teaching implementation science, where I say, okay, think of an evidence-based intervention, right, as, for example, a cardboard box. It's a box, but not very strong, okay? So that's your EBI. You go through an implementation process and several cycles. Some of you can see this and think about PDSA cycle, right? Plan, do, study, act cycle. You're bringing in some quality improvement here. Goes through several cycles of implementation. And the approach to implementing it, or the approaches to implementing this EBI, are implementation strategies. So you apply the implementation strategies in the process of implementation. And ideally, at the end of that process, or as the process is going on, your EBI, which maybe was weak and not well implemented, becomes a steel box. It becomes an ideally implemented EBI. It becomes stronger. It has a better impact. It is better used. And in this process, after you are implementing this EBI and you take it from a cardboard box through several cycles of implementation and applying your implementation strategies, at the end, you have to measure your success. And these are measures of success here. Your effectiveness outcomes are measuring the success of the intervention itself, of its impact, of what it's supposed to do. The implementation outcomes measure the success of implementation. So, and then after you have these effectiveness and implementation outcomes, these are then, the knowledge you have from that are then applied into policy and practice and routine healthcare. So you start with an evidence-based intervention in implementation science. It already has evidence backing it, whether it's partial evidence or full evidence. And then you take it to the methodology of implementation science. You strengthen the EBI, you strengthen its use, and ideally you maintain or even improve its effectiveness, and you have successful implementation that you measure using implementation outcomes. And then you can take this into policy, practice, and routine healthcare, and now implement it as a routine, well-skilled up EBI. Now, so again, this is the what. It's either poorly implemented or not implemented. This is the how. These are approaches to make the what, the thing, better. And this is where implementation science operates. I want you to understand, implementation science does not operate with the evidence-based interventions. It operates in the strategies and the implementation of the strategies. And the implementation of the strategies and their success is measured by implementation outcomes. So implementation science is a science of implementation. It's the science of the how. It is not the science of interventions. That's intervention research. So please, I just want you to note that. All right. So we cannot talk about implementation science without talking about implementation outcomes. As I said before, it's the measure of success of implementation. So implementation outcomes are the effects of deliberate and purposive actions to implement new treatments, practices, and services. The outcomes are the effects of deliberate and purposive actions. And you see here that the deliberate and purposive actions are actually your implementation strategies. So as I said, implementation outcomes are the measures of success or failure of implementation strategies. And you can also consider them the measures of the success of implementation in general. Now, we have certain implementation outcomes that have been proposed and that have been used for a long time in implementation science. These are called the Proctor's implementation outcomes. And there are about 8 of them: acceptability, adoption, appropriateness, cost, feasibility, fidelity, penetration, or some people call it reach, and sustainability. These are the implementation outcomes that you use to measure the success of implementation or of implementation strategies. However, I want you to know, because I know there are many people here who might be health services research people, public health research people, that there are also service outcomes that are related to implementation outcomes, but that are complementary to them. And these are listed here, including effectiveness, equity, patient-centeredness, and safety. People do a lot of safety and effectiveness studies. These are service outcomes. And then we go over to this next box where we have client outcomes, patient-level outcomes. And these are outcomes reported by patients, patient satisfaction, patient function, and patient symptomology. All right. So this slide is about implementation outcomes, but I want to mention that there are service outcomes and client outcomes, which in implementation science projects may or may not be also measured alongside the implementation outcomes. And I've defined what the service outcomes here are here. They are the level of the health service delivery system. Client outcomes are the level of the client or the patient. And then service and client outcomes are together known as health outcomes, which are events occurring as a result of a health intervention. All right, so another thing that we measure that we discuss in implementation science is really what helps us to have structure, rigor, and organization when we consider an evidence-based intervention, when we consider its implementation strategies, and when we consider its implementation outcomes. It is theories, models, and frameworks. And you cannot do implementation science without this. And these entities are often a source of, a lot of trepidation, a lot of fear, a lot of intimidation. But I'll tell you, if you've been doing implementation science for a long time and have not, dug into theories, models, and frameworks, you have not done implementation science the way you should be doing. You have to work with these theories, models, and frameworks. So these are guides for researchers and practitioners to organize their implementation science work. And TMFs are typically grounded in theory. Okay, so this is where someone like me, who in research, I was initially trained as a quantitative researcher. And then I learned some qualitative research because of implementation science. And so thinking about, theory and models, these are all largely from social and behavioral science, but you have to key into that if you're doing implementation science. So theories, models, and frameworks are typically grounded in theory, meaning that they help to predict or explain human behavior. That's what social scientists, behavioral scientists do when they use their theories and models. They help to predict or explain human behavior. And in this regard, in implementation science, these theory-based TMFs help to explain human behavior as related to the implementation of evidence-based interventions. Why? Because implementation is a human process. Implementation is done by humans. And with that comes human factors. And so it makes sense that we use theories of human behavior to guide implementation science methods. So there are some theory models and frameworks who are not really grounded in theory. So for that, we just consider them checklists. But the true theory-based TMFs are the true theories, models, and frameworks that we use in implementation science. All right, so giving just an example of the categories of theories, models, and frameworks, or theoretical approaches used in implementation science, you can have where you have theoretical approaches that are describing or guiding the process or translating the research into practice, right? So these are called process models. There are some that help you understand or explain what influences the implementation outcomes, whether it's acceptability, feasibility, fidelity, cost. And these are in these three groups here, like determinant frameworks, classic theories that come from social science. And then there are specific implementation theories. And then there are some theoretical approaches that help you to evaluate implementation. And these are called evaluation frameworks. So those are the breakdowns for theories, models, and frameworks. And I'll just give a few examples here. For example, process frameworks, knowledge to action is one of them. Some of you may have heard of EPIS, exploration, preparation, implementation, and sustainment. Is actually a combination of determinant and process, but it's a very strong process framework. We also have down here determinant frameworks. There's one called Paris. There's the theoretical domains framework, and one that's quite popular, the consolidated framework for implementation research. Then there are classic theories like social cognitive theory and theory of diffusion. And then implementation theories, some called the organizational readiness theory, and then the Combe model. And then also for evaluating implementation, many would have heard of the RE-AIM framework or precede, proceed that are used to evaluate the process of implementation. So how I put this together is to think about implementation science, not just as research, because we tend to think of implementation science as research. A lot of us, including myself, when I first heard about implementation science, it was in the context or the setting of research. But there's a practice component to implementation science, and we'll talk about that on this slide. So I said before that, there's intervention research, which is separate from implementation research, but related to it, because intervention research actually produces the evidence for evidence-based interventions. So this focuses only on efficacy or effectiveness of an intervention. And the main question that intervention research is asking is, does it work? And if it's yes, then you have your EBI. And as I had mentioned earlier, program, practice, principle, et cetera, et cetera. These are all EBIs. But then now you go to implementation science. And strictly speaking, if you take implementation science in its definition, strictly speaking, because we tend to interchange implementation science with implementation research. But if you think of implementation science, strictly speaking, is really the developing and theorizing for the methods to move evidence into practice and policy. So the question is, what methods and tools, and really should be what theory-based methods and tools do we need to accelerate the use of evidence? Now you come under that umbrella and you have implementation research, which systematically applies and studies IS methods in real-world settings. So we're asking, does the EBI work in this context? How can we make the EBI work optimally in this context? What strategies can make the EBI work best in this context? Then there's implementation practice, which we don't talk about as much. And this is the application of evidence that's emerging from implementation research. And you're applying it to different contexts and settings to meet unique needs of communities and people and to improve outcomes. And so the question that we ask and that we try to answer in implementation practice is, how do we successfully implement the EBI in everyday, routine, regular public health and clinical practice in this context? So very contextually oriented. And so the people who do these different aspects here for implementation science are implementation scientists, then there's implementation researchers, and then there's implementation practitioners or implementation support practitioners, which include clinical and public health providers, patients, and policymakers. But you don't automatically become a practitioner because you're a clinician or a public health provider. You have to learn and use implementation science methods. But a lot of the work we're doing is already implementation. Now we need the methods to really make our work rigorous and then take us from being clinicians and public health providers to being implementation practitioners. All right. So I wanted to now switch and talk a little bit about some examples of the use in implementation science, the use of implementation science in health service research in Africa. And then I'll switch to talking about health service implementation or health practice. So I'll give an example, a personal example from my first implementation science study, actually. Was called the MOMENT study, the Mother Mentor study, and was a 5-year study from 2012 to 2017. So the problem we're trying to address was poor maternal retention and late infant presentation for HIV testing in PMTCT programs. So here you see a mentor mother counseling her client. The client has 2 children. We want to make sure that the infant particularly is brought in on time for early infant diagnosis, and that the mother herself is also retained in PMTCT programs so that she can have positive outcomes and long-term health. Now, for the mentor mother study, for the MOMENT study, the evidence-based intervention, as we saw it, there was mentor mothers. It already had evidence because it had been widely implemented and tested in South Africa, and there was evidence to show that it worked. But at the time that the study was implemented, there was no evidence from West Africa yet for mentor mothers. So again, the context has changed. We're now trying to test it in a new setting. At that time when I wrote this grant, I didn't use a framework. I didn't even know about implementation science frameworks. So this grant was written without a framework. And retrospectively, or in retrospect, if you think about it, the hybrid design was really a type 1, meaning that we were more focused on the effectiveness of the intervention than implementation. But we did collect some data on implementation, but it wasn't a very strong focus. And so, which is where maybe we could be forgiven a bit, because really, if you are going to evaluate implementation, and implementation is very important, you need frameworks to help you measure the success and process of implementation. Now, in terms of implementation strategies, our whole approach to the strategy for mentor mothers is actually to structure it and make it more formal and rigorous in order to improve its impact. So we had a standardized curriculum for mentor mothers, training and tools. We did performance audits of the mentor mother program. We did task shifting, where we revised and explicitly defined roles between mentor mothers and healthcare workers at their facilities. We had supportive supervision for the mentor mothers, and we provided standard and consistent mentor mother pay. And that is an implementation strategy. If you have healthcare workers, or even lay workers implementing a program, and they are not paid regularly, and they are not paid a standard amount, your implementation success will drop. And we all know this, a lot of us know this from experience. So that's an implementation issue, standard and consistent pay. And in terms of implementation outcomes, we measured acceptability, we measured fidelity, and we also measured, evaluated cost. We did a cost effectiveness analysis. So I want to shift from that example to talk about another study. It's not HIV, but it's still maternal child health. And this is the IVON study. And the IVON study is a study that myself and Dr. Balogun were working on, which was looking at the use of IV iron to reduce anemia in pregnancy. And here what I'll do is show its conceptual framework, but it still gives you an idea of the application of implementation science here. So what did we want to change? We wanted to change the problem of anemia. We used the EBI of IV iron, which had been used in North America, Europe, Australia, many other places, and even in India as well, for treating anemia. But we hadn't had that experience, at least in the health system in Nigeria. So again, new context, new setting, an EBI that we wanted to use to address a problem, a local problem. So how do we maximize the intervention success? Of course, implementation strategies. And in doing that, in trying to identify which implementation strategies will be helpful, we need to look at what factors will positively or negatively affect success. Some people will call these barriers and facilitators. Some will call them determinants. And this is where determinant frameworks come in. So here, we use the determinant framework to help us evaluate and collect data on these factors by doing qualitative studies. So we use the consolidated framework for implementation research. Now, after doing that, what did we find out? We decided, okay, based on the facilitators and barriers we have found, we now can use that to help us to select the best implementation strategies. So we assess for readiness. This is actually a strategy, assessing for readiness and identifying barriers and facilitators, which we did. Then we re-examine implementation. We keep checking implementation and re-examining it so that we can do quality improvement. We tailor the strategies to our sites and our settings, promote adaptability. We used an implementation advisor. Yours truly was the implementation advisor for this project. Conducted ongoing training in the case management teams. We used train-the-trainer techniques, and then we organized clinician implementation team meetings. So all of those were our implementation strategies. Then how did we measure the success of implementation? And I put all the Proctor's implementation outcomes here, but the ones that I've starred are the ones that the IVON study measured: acceptability, feasibility, fidelity, and costs. How does our intervention and its implementation impact health services? We looked at service outcomes. Remember, I showed you a slide on service outcomes. So the ones that we focus on are starred here. We looked at safety and effectiveness of IV iron. And then the last question, how does our intervention and its implementation affect the patients, right? And here our patients were both mother and child. So our client outcomes were looking at an increase in maternal hemoglobin and reducing infant prematurity. So those are two examples from research studies. Now, I wanted to give some scenarios in health service delivery and routine practice with respect to applying implementation science in African countries. So here we want to look at the role of implementation practice in, and not in research, sorry, in service delivery. So we know that we're taking knowledge to practice or evidence to practice. We want to go from knowing to doing and reducing the gap. We want to take evidence-based interventions to having them have high uptake and integration into routine healthcare. And as I mentioned before, implementation science is what is helping to bridge this gap. So now let's expand that timeline a bit and start from the knowledge. What works? And in doing that work, we are able to now bring up evidence-based interventions. Those are the things that work. We have tested and we know they work. Now, we want to take it to routine practice here, where we have sustained integrated interventions and their delivery has been sustained and integrated with impactful implementation strategies. What do we do to achieve this? We conduct implementation research, which answers the questions of what strategies will work to deliver the EBI that was already produced. But now we need to find out what strategies work. That's the work of implementation research. Then implementation practice. How do we deliver and maintain quality evidence-based interventions and strategies from day to day? So the research and the practice are actually hand in hand. But a lot of times we do the research and we want to jump to routine practice, or we are implementing, but we are not really doing it with the methodology of implementation science. And so this is the ideal picture, that we have an evidence-based intervention. We want to take it to routine practice and sustain its implementation. But then we have to generate data to help us select and test implementation strategies for us to know which ones work best. And then we bring it to implementation practice, which helps us to figure out how to do this on a daily basis and routinize the evidence-based interventions and its strategies. All right, so one of the things that we have to look at is, people ask, what are we supposed to do in implementation practice? You define it, you describe it. What exactly are we supposed to do? So there are some principles and core competencies when you are doing implementation practice, if you are an implementation support practitioner. First of all, co-creation and engagement is critical to doing implementation practice. You are co-learning, brokering, you're addressing power differentials, you're doing co-design, you're tailoring support. And a lot of us who are implementing, whether it's HIV programs, TB, malaria, immunization, we do a lot of this work. And we have ongoing improvements and then sustaining change. These are sort of the trifecta of implementation practice. And we have to look at equitable implementation, which occurs when strong equity components are integrated to facilitate quality implementation of effective programs for a specific community or community. So as you're doing your implementation practice, you have to build in equity, meaning that you have to get the benefits of the EBI to the people who need it most and to as many eligible people as possible. So I'll give you a scenario here. Scenario one, let's say in a PEPFAR program, is where you want to take knowledge into practice. You have scenario one, where we may have WHO policy, we have Nigeria policy, we have PEPFAR policy. Sometimes we have many competing policies for doing the same thing. So we go in, we develop job aids, data collecting tools, we train staff, we activate, we have sort of an ad hoc approach to implementation issues. We report without understanding exactly or fully what we are doing. And we don't have any implementation science methods in practice. And we are trying to go from the knowledge to practice and doing this. Now look at scenario two, where we have the EBI, say it's a new antiretroviral. We have policies, right? We have policies on ground, but we have strategies we want to use to implement the EBI. We name them and we make sure that we are measuring our outcomes according to these things. Multi-month dispensing, community ART, community pharmacy. These are all implementation strategies. And then we move from there to implementation practice. We are looking at clear definitions of what is an intervention versus what is a strategy. As I said before in the previous slide, co-creation, ongoing improvement, sustaining change, and using IS methods in practice. And then in doing that, then it takes you into routine practice. So there are methods here that we are jumping over and we are not doing. And we end up trying to get here and it's not working. And we keep having to go back and try and sort these things out. So in the end, we have confusion down here, or relatively more confusion, and really have a better outcome because we are systematically delivering services. So being systematic is not only for research, it's also for routine implementation or day-to-day implementation or practice in healthcare. All right. So IS and healthcare in Africa, IS is still being described as a new field. I know we have 15 minutes left. I'll be done in a couple of minutes, and then we can have Q&A. IS is still being described as a new field. From the literature, you can see that IS started coming out on the global scene in about the early 2000s. But there were some pockets of IS being practiced way before that. But those were largely in US, UK, Australia. Really, the pioneers of the field of IS came from those areas. And then these are the implementation scientists who developed the earliest implementation science theories, frameworks, and models. And a recent scoping review showed that as of at the time they published it, there were 143 theories, models, and frameworks in existence. None of them were developed in Africa. Okay, and see here the Sentinel paper by Laura Damschroeder and co, which described the consolidated framework for implementation research. This came out in 2009. That's not that far long ago, right? That's about 15 years ago. So depending on how you look at it, it could have been a while ago, but really it was, this is 2009 when CIFA came up, and now it's been used, you know, thousands and thousands of times in the literature. But noting that we are not really in African countries producing these theories, models, and frameworks. You know, what is that? How do we advance implementation science in healthcare in Africa if we are not contributing to generating tools for the field? We can still contribute by actually advancing the field by application and by rigorous application. And for advancement of any field, we need people to do the work. We need people to build and advance the field through observing, teaching, and practice. We need implementation scientists, implementation researchers, implementation support practitioners. In Africa training, we need that. We need capacity building. And after a while, I get tired of using the term capacity building. I want to do skill building. Capacity building is increasing the potential to do something. Skill building is actually applying it. We build capacity a lot, but we don't see people actually using it. People go to a lot of trainings and don't use it. We need to build capacity and build skills, which is the demonstrated capacity is skills. So we have, I have a training program that I'm implementing with Professor Alashli Abimiku at Aisha. That's an HIV implementation science training program. NISA has webinars and trainings. Kawisa is also mentoring and training people across Central West Africa. CC-Trace in Lagos is the Center for Clinical Trials Research and Implementation Science. They have work going on there too. CITER, the Center for Translation and Implementation Research at UNN Enugu, also has capacity building and application. And then WITS University, really, if I look at universities across Africa, the one I can think of is WITS, that's actually producing people with masters and PhDs in implementation science. And within our programs like PEPFAR and Global Fund, HIV, TB, malaria programs, there are many opportunities to do implementation science, particularly implementation practice. There are large consortia where we are working and trying to apply implementation science or train people. And I'm involved with, I'm just mentioning MPOX Research Consortium. Even for pandemic response, implementation science is applicable. And then of course for AFREhealth. And then in US, yes, some universities that are very well known for implementation science, and they have been producing people with PhDs and masters in implementation science for years. You know, but in Africa, we are lagging behind in that. So this is something I took from clinical science or clinical care. See one, do one, teach one. That's really how you advance the field. That's really how you build expertise and experience. So last slide here, what are the top 10 things you need to apply to your health research or practice in Africa for implementation science? You need to understand what IS is and how it can enhance health outcomes, find and use learning or growth opportunities like courses, find mentors, build collaborations that include IS learning expertise, examine your own work, find gaps that IS can address, and build in health equity as you're doing that. identify the specific aspects of implementation science that you focus on to address the gap. Are you looking at determinants? Are you trying to look at evaluation? Are you trying to look at the process of implementation, or all of them? Learn about some of the pillars of implementation science, like theories, frameworks, and models. Use them. Not only learn about them, but use them to guide your work. And then I have 3 lessons here that all involve doing the work. Write grants or concept notes for your program or practice. Do the work, implement your IS projects. Do the work, write abstracts, papers, or reports that are relating to implementation research or practice. So I will stop there. I have a host of people who really help me to do the work that I do. My institutions of affiliation that are in the top row, my funders, and then the consortia that I'm part of course, including AFREhealth, the African Forum for Research and Education in Health. And I do want to thank you for making it this evening or afternoon or morning, depending on where you are, to this talk. So thank you very much. I'll hand it back to Dr. Balogun.
Thank you so much, Prof. I think we can appreciate Professor Nadia for such a rich presentation. You literally took us through almost everything about implementation science, and I loved the examples you gave, for the African settings, the way forward. So things for us to take home and think about. I'm sure we've learned a lot from this educative presentation. Thank you so much, Prof. We'll now go into, we have a few more minutes for Q&A. Let me look in the chat if we have any. Okay. None in the chat yet, but if you have a question for Professor Nadia, you could use your raise hand feature, and then I'll call you. I'll ask you to unmute. Yes, the chair of our webinar committee. Please go ahead, Dr. John Bosco.
Thank you very much for the excellent presentation. Yes, I'm glad that you mentioned the VITS versus in South Africa, where they have an implementation science master's and PhD program. So for people in the West African side, do we have any of such university where people can go to for graduate education? And if we don't, are there any plans for any institution to start something like that? Thank you.
Yes, so thanks for that question. So with respect to West Africa, I'm personally not aware of any educational academic institution that is doing graduate programs, like degree programs. The training opportunities that I see in West Africa are as a result of training grants. So they might be like 5-year grants, whether it's from NIH or maybe EDCTP, that are training people in implementation science. There are some NIH grants, training grants that are implementation science PhD training grants. And actually the one at Wits University was from a NIH training grant. But in West and Central Africa, apart from, like for myself, I have an NIH HIV implementation science training grant. There's no institution I know that's actually producing PhDs or masters in implementation science on ground and locally, no. Now, are there plans? Of course, it's something that I would like to do. What Kawisa is doing is basically mentoring and training a few people, but we are not a degree program. That takes an extremely high amount of resources and facilitators. The problem is you need faculty. And if we don't have enough faculty, a critical mass of faculty who know what they're doing to teach this, then we are not ready. And so we are not ready because we need to build the faculty. So I hope to see Dr. Balogun and co, who are at the point where I can say, okay, come and join our faculty and or start your own program and let's start teaching. But we don't have a critical mass of faculty yet. We don't. So thank you.
Very soon. And I just wanted to add quickly that for CCTRIS, the center Professor Nadia mentioned earlier, the Center for Clinical Trials, Research and Implementation Science, domiciled in the University of Lagos. We are about, I say we because I'm a deputy director for the implementation science arm of that center. We're about concluding our curriculum for short courses in implementation science that would be led by faculty, local faculty, we hope most of it, and will be online. So we're working towards that, and as we test that out, it will probably in the near future, hopefully, we could start talking about master's program coming from that center for implementation science. We have another question that Modai, please could you unmute and ask your question? Thank you.
All right. Thank you, Prof, for such a wonderful presentation. I am Dr. Modainenwa from Malawi. I'm a family medicine specialist based at one of the district hospitals in the country. When you went through your presentation, I was just reflecting a couple of activities that we are running at the district hospital. We have two quality improvement projects that we are running. And when you are talking of the implementation frameworks, I was reminding myself that, that's what I've been doing, but I didn't know the theory behind it. So, so is there any possibility that you could either link me with someone who has knowledge about implementation science? Because from your presentation, now I'm beginning to plan that after we finish the quality improvement projects, probably we need to write something about it and publish. And also it's an opportunity for me to learn concepts of implementation science. So is there a possibility for either online resources that you may link me with, or maybe faculty that have knowledge that maybe we could be talking through emails? At the same time, is there a possibility that you can also share your presentation?
Yeah, I think in terms of the slides that AFREhealth will share, they usually do that, share video and all the slides. For resources, one of the first places I'll send you to is the University of Washington Implementation Science page. I'm just trying to get, I should have done this already. But they are a wealth of information and it's free. But from there, you can get information about all types of implementations, and they do it step by step for you. Very, very helpful. Even myself, up to date, I've been using it for many years. I think it's a bookmark on my computer. So here's the URL. Go there, and that alone will be able to really help you to do your work. Yeah. And people in Malawi for implementation science, Sampiri, but he's a very busy person. A lot of people know of him. I can't think of anybody off the top of my head. Thank you.
Sampiri is working with which institution?
Sampiri, he was with Lighthouse, but I think he has moved. I can't remember where he's gone to, but he's not that hard to find. It's just getting his attention too. So my first grant, he was one of the grantees for that first implementation science grant. So he was a PI for one of those grants too.
Okay, thank you. We have just one more minute. I want to read out the question by Professor Asta on the chat. Very educative presentation, Prof. Thank you. Is it a must to have IS masters or PhD degrees to do IS? Second, without giving the name IS, isn't some of the things we do already IS?
Yes. So first of all, you don't need a master's or PhD to do it. I don't have a master's in in fact, I don't have a master's in anything. I don't have a PhD in anything. I have a pediatric infectious disease fellowship that included a research component. I had to basically scratch my way through and learn from short courses, self-directed learning, writing grants, getting the grants, implementing them. The easier part is to go and get a degree. And so that's why I'm asking people to do that, but it's hard to find them. So you don't have to. The thing is to be conscientious and diligent in learning the methods and doing them over and over and over again. So see one, do one, teach one, see one, do one, teach one. Okay, and then you start sort of being able to stand with the people who have the degrees, but you have to be good. You cannot do it anyhow. You really have to be diligent, but you don't have to have the degree to do IS, especially if you are an implementer, because it's part of your job every day. So, but learn the methods and apply them and learn from other people who have done it, yeah. And it's what we are doing IS. Yes, some of it is already IS, but you have to be able to know the name, to give it the name so that you can say that that's what you're doing, you know. So that's part of what I do when I teach people about IS, is to have them start to see the light that some aspects of what they are doing are IS. Now, your job is to go and then get more rigorous methods and skills in doing it and doing it well and calling it IS with your chest, so to speak.
Yes.
Right. So that's what I try to inspire people to do as well.
And thank you so much, Professor Nadia. We are a minute over time. I will just invite Professor Priska once again to give a brief vote of thanks and then closing remarks. Thank you.
Excellent, excellent facilitation, excellent facilitation, excellent moderation, excellent planning. And I want to say excellent audience. Thank you so much, everyone, for participating. I want to thank Professor Nadia for being with us and making it very informative, very educative, very enlightening, very warm. We want to say thank you so much. Thank you, all participants. Please fill the evaluation form. It's there. And if you want to join AFREhealth, there's a link on the chat room. Kindly click on that link and join AFREhealth. You are all welcome. Thank you very much. Have a nice weekend.
Yes. Good night,
Thank
everyone.
you, everybody.
Bye.